Welcome to the Catalyst Effect podcast. I am your host, Isaac Carter. We are doing a special series of The Voice of the Founder in conjunction with Lions Den DFW. Lions Den DFW is doing their annual pitch competition and entrepreneurship conference on April 29th and 30th at Dallas Baptist University. Had the opportunity to tour the campus there yesterday and see where the event is going to be. It's really awesome. And we have had the opportunity to speak to almost 40 applicants for the pitch competition. I can announce that ReFrontier is in the top 10. They will be pitching in Dallas on the 29th, I believe. And I have the founders and the team from ReFrontier here with us on the Catalyst Effect podcast today. Kurt, Katrina, Daniel, thanks so much for being here. You guys have some really interesting backstories. So I know that you guys have been in war zones. I know that Katrina is the one that goes out in the dangerous spots where Kurt stays home where it's comfy. And
that's 100%.
Daniel, you kind of stay in St. Louis, so kind of the dangerous spot too, right? So tell us, how in the world, the whole world, the three of you and your team come together and start solving prescription and medical. Well, tell us about your backstory, what you do, and what problems you guys are solving.
Yeah, sure.
I feel like there should be like a Kurt and Katrina, like how they met, and then I'll throw myself in.
Okay.
Half, I guess you could
Katrina, kick us off.
Kick us off.
I love it. Yeah, so thanks so much. It's really a pleasure to be with you, and I appreciate you making the time and giving us the invite. We're excited to join everybody at Lions Den.
And I appreciate your flexibility. I think this is our fourth try. So much.
Frontier markets will teach you endurance. A little bit of my backstory. So I am the child of a Finnish mother and a British father, but grew up in West Africa, in Sierra Leone, and then in Papua New Guinea, and then did my secondary school and my university in the United States. So I really grew up living in frontier markets, right on the edge. And I grew up as the child of two development workers, both my parents. I went on really to grow a passion and a desire for seeing human flourishing come about, and particularly in the hardest places. And so I was in my mid-20s when I bought my first one-way ticket to Afghanistan to go and volunteer for a local organization there.
Totally see her just like going, let's go to Afghanistan.
If she has a conversation with me, we might make it happen. Yeah, I had previously been doing work in inner city DC and Northern Virginia, working with MS-13 and gangs, and so it was a different kind of a pivot, but, on brand, I think. And I went out to Afghanistan really with, I think, just a conviction that where I was peculiarly gifted and called and drawn to were the places where the issues of injustice and of pain and of brokenness were most profoundly felt. I have a particular passion for women and girls and the effects of violence on women and girls in particular. But that was kind of my way into some of this work. So I went on to work for the UK government and for the United Nations, as well as for various international NGOs. I spent about 2 decades in fairly senior levels in international development. And then it was through meeting Kurt in Afghanistan that I began to make a bit of a pivot into really thinking about what more holistic solutions to the world's biggest problems I needed to include. But maybe I'll let you talk about how.
Yeah, we know that Katrina is just an adrenaline junkie out looking for the biggest problems to solve.
Yes.
What were you doing in Afghanistan?
Well, I grew up, my dad was a pilot with Mission Aviation Fellowship.
Okay.
So I grew up with adrenaline. I learned how to fly before I could drive. So started in Ecuador.
What does your do better, fly or drive? Ecuador is actually a really interesting place in the history of missionary aviation. So it's interesting that you were there.
I grew up in Nate Saint's.
Nate Saint, yeah.
I knew his wife, his widow, and his sister. I met Elizabeth Elliot as a child, and I met one of the men, at least one of the men, I can specifically remember, who had killed the 5 Christian workers there, and he had come to the Lord. And so as a child, I saw the beauty coming from ashes, out of the terrible tragedy, I saw God glorified. So it was a really big impact on me. And then I moved to New Guinea, on the other side of the island from where Katrina was. Irian Jaya used to be called. My dad also flew helicopter. There's a tragic story there where two of the Christian workers were killed and actually dismembered and eaten as to desecrate them. And yet again, God's glory was shown in all of that. So I grew up with a lot of adrenaline, flying in the bush airplanes. I'm an engineer by training, bought and sold a company in Seattle, and then went into Afghanistan and helped launch the national mobile phone company there. So we turned it from 0 to 200 million in revenue in about 3.5 years. Became a $1 billion company, and it was wild and crazy. While I was flying in the company airplane across almost every corner of Afghanistan, this would have been 2003, starting in 2003, I could look down and see Katrina riding on the horseback, eating.
I haven't heard this part.
Eating cooked goat and all those things while I'm flying up here in the corporate airplane. So
he was busy adulting.
Yeah, we met at church. We met at the International Church there. It took us 5 years to fall in love.
It's been a roller coaster.
Yeah, and we brought together, honestly, I'm business, entrepreneurship. I started 2 other companies beside the mobile phone company, but it brought the business, the economic engine, and the social development, the beauty of that side where you're dealing with systemic issues, public health, but the economic engine that is so needed and so powerful. In our marriage, it brought us together, and we fought like cats and dogs in the beginning because we were talking different language, but in the end, we've come together, and this is the model of ReFrontier.
Wow. So Daniel, yeah, I feel like I should have had you go first, but go ahead, Daniel, top that.
Great rest of your day. I do like to say that now that Kurt and Katrina are fresh off that story, there really is a representation. So there's ReFrontier Group, and then we have 2 arms, ReFrontier Ventures and ReFrontier Foundation. And they really are representative in many ways of each side. And the important part is the mutual submission.
There we go.
Connection between the two and how the two work together to ultimately contribute to human flourishing, sustainable business, sustainable enterprise, etc. Throwing that one in there, fresh off the book, because that sounds cooler than what I'm about to say now, which is
How do you come into the mix, Daniel? Tell us about you.
I do. Yeah. I'm gonna keep with the aviation theme here because we've got looks like maybe is that a DC-10?
DC-10. Yep.
And then, Kurt's got so I won't get into all the background, but I actually started out in a trajectory of an airline career. So I went to school, learned how to fly, got my commercial license, all the ratings, endorsements, etc. And then ultimately, again, without getting into the backstory, ended up moving in a different direction, found myself, I guess you could say, in the world of private enterprise, and always had an interest in an entrepreneurial bent. I was the kid, as a 10-year-old, like canvassing the neighborhood, selling whatever the latest thing was to sell, whether it was like wrapping paper and gift cards or Christmas trees or wreaths or candy bars or lawnmowers or motorhome washings, raising cattle. I mean, there's a whole list of things. So even though I wouldn't have classified it that way at the time, that is a little bit of how I'm wired, I guess you could say. So ultimately, a couple of different, I'll try to make this a little bit concise, I guess. Liberal arts undergrad, Middle Eastern studies sort of minor, I guess you could say, studied Arabic, lived in Cairo, here we go, for a time, got married, lived in Doha, Qatar, actually for a time as well. Ended up co-founding a company with a handful of other guys in the health tech space. We weren't the first to do it, but we were the first to really trailblaze the subscription concept in the world of dentistry. So we grew that quite rapidly to all 50 states. Eventually, that entity and several others were bundled up and acquired by private equity in 2018. What's next? And so it was in this period that I actually was introduced accidentally or providentially, depending on your perspective, to Kurt. And the very quick version of that is a buddy of mine who knew of my interest in just getting into business in some way in the Middle East had a connection with somebody who'd run a successful coffee company franchise throughout, I think, GCC countries and maybe Egypt and some other spots. Kurt hits reply all, like I hadn't replied yet. But Daniel, great to meet you virtually, and let's talk if you're interested in international.
And that's how we got together.
Yeah. I mentioned to these guys that I knew a little bit about medical epidemiology and evidence-driven medicine, and they're like, come to Nigeria. So I know you guys are very, very welcoming folks. I literally interviewed somebody who was in a bomb shelter like 3 kilometers from Armageddon, and he was nowhere near as exciting as the three of you guys. So it makes your conversation, when I asked you a couple of weeks ago on the due diligence call, hey, how are you handling security? And you guys basically laughed at me like, security? What's that all about? It all makes sense now. So
when I visited Kurt and Katrina for the first time in Nairobi, generously hosted me for a few weeks, and I had a little bit of extra time at the end that was unexpected. And I was like, where should I go? And a couple places were thrown out, but Lamu Island, which is now right here on my wall, was one of them. And I remember, to your comment on the State Department, I remember looking at the site and it was like, do not travel too close to Somalia. And then I was like, Kurt, Katrina? They're like, ignore that, just go. And it was amazing. And
all relative.
Yeah. Well, I was told, hey, if you're going to Central America, make sure you blend in. I'm like, I'm 6'6", 2 meters tall. I'm white as a ghost. There is no blend. Everybody else is like this tall.
Spanish?
Very bad. Yeah, no, I know enough Spanish to get lost on the way to the bathroom. If el baño está anywhere but aquí, I'm in trouble.
I bet we could get a camera crew following you around, Isaac, and you could have your own show. Maybe.
That's been done. It was called The Adventures of Gringo Loco. So I Gringo Loco. I'm sure you could find the videos out there. I was a minor celebrity, and yeah, I was recognized at an airport in El Salvador once. But yeah. So what exactly is ReFrontier Group? I know you guys have seen a very large inconsistency in the quality of healthcare and medications. I know that you guys are addressing it right now in Nigeria. I have obviously done a little bit of travel, and I've seen this at many countries through Latin America with inconsistent access to quality medication, healthcare. This is heck. In central Georgia, my sister has been waitlisted for medical care for 6 months. Just worldwide access. If you don't have enough money to walk into private clinics and pay for it worldwide, you do not have access to some of the best medication and adequate medical care. But here you all are in Kenya with a solution to this. Talk to us a little bit about that.
Maybe I'll tee up sort of the problem statement, which is something like nearly 3/4 of all Kenyans live 2 or more. And that is something that we in the West, and specifically here in the United States, right, we take for granted. And so if my kid gets sick or myself, my first thought is like making a phone call to get an appointment, as long as it's not an emergency, right, at the local primary care doctor. But in most emerging and frontier markets, it tends to be the chemist or the pharmacist that's the first point or the first line of care that's diagnosing and writing prescriptions, right, making a referral, whatever the case may be. So with that in mind, one of the core companies of our portfolio is Zana Life Pharmacy and Supermarket. And maybe with that, Kurt and Katrina, you can touch on a little bit more of the specifics, you know, on the ground that you're seeing of the why and then how we're solving.
Yeah, I think it's really important to understand that the pharmacists in much of Africa are the primary care, are the family doctors. And so if a child is sick, the mother will take the child often first time to the pharmacy. The public health system is generally not very good. It's slow, it's distant, so you go to the pharmacist. But it's normally 2 hours even to get to a pharmacist, or the pharmacist is actually 50% of the pharmacists are unregistered. In other words, they're not real pharmacists. 30% of the pharmaceuticals are counterfeit. So that is a real issue when that's the primary touch point. And we at Zana Life, ReFrontier, are solving that problem by placing pharmacies, registered, high quality pharmacies and pharmaceuticals into every county of Kenya in a hub and spoke model that will eventually go to 400 locations across Kenya. And that will decrease that number from 2 hours down to less than an hour geographically, that they will get access to a high quality pharmacist who will be able to do diagnosis, will be able to actually give good drugs. And that is a major, major change that we're making at the national level.
It's amazing. Yeah, I think some folks here in the U.S. are going to be a little bit like, wait a second, you've got a pharmacist doing diagnosis and recommending medical care. So I want to tell a little story. There is 2 mountain ranges in Nicaragua. I make the joke that if it's raining, if it's drizzling or foggy in Carazo, it's flooding in Managua. And underneath, a little lower than Managua, there's a little village. On a dry, good day, a 4-wheel drive truck can barely make it back to this village. If it's raining anywhere, they're cut off. They're cut off from fresh water. They're cut off from medical care, from everything. And of course, they're not getting physicals done on a regular basis because there's no medical care there. So one of the girls from that village went to Managua and studied to be a nurse, and she felt called to go back to the village and help them. And so she went back with nothing. She was in this village and she had some training, but she didn't have a surgical kit. She didn't have bandages. She didn't have a stethoscope, nothing. So I built an $800 kit with a ECG machine, a surgical kit. I had a medical doctor go down there and teach her how to stitch. And she was already a trained certified nurse, and gave her a bag that allowed her to do physicals and preventative care, and advised folks, hey, you need to leave this area to get medical care and do preventative medicine and emergency medical care. That one thing, a $700 bag in the hands of a trained person, and by training, we don't mean 6 years of medical school and a 3-year. We mean somebody that can do first aid and have basic wound care. That is enough to completely elevate the entire quality of life for that village. To get to a point where a storm and chest pains isn't an immediate death sentence, where a 2-year-old with a fever in the middle of the night has a chance of some sort of medical care. So what you all are saying is even more than that. You're actually bringing in certifications and access to, I believe, some sort of telemed, some evidence-driven medicine, and quality medications. That's going to save lives.
Absolutely. And it's worth noting that it's actually at a policy level within Kenya and several other nations on the continent. More and more of the governments are moving to this pharmacy first model because they recognize the most sustainable, most efficacious way of moving healthcare farther and farther out. I think the other thing to say is what we get to layer on to some basic diagnosis is also the real preventative side of healthcare that actually upstream makes a massive difference to staving off chronic diseases, early childhood diseases, maternal mortality, etc. So we're working with all of our pharmacists to develop up more and more protocols and systems around doing all of those basic screenings for your cardiovascular, metabolic, your other sorts of diseases that are most common that we know we can catch early on and then actually begin to prevent. For much of the African continent, what you have at the moment is a crippled healthcare system that is now having to deal not just with communicable diseases, so these are the diseases we typically think of within Africa, but also with things like hypertension, diabetes, these sorts of more developing country diseases, right, middle class diseases. And these are converging on a population and on a health system that just is not adequately set up.
Yeah.
And so when we can combine in a pharmacy model that is out there based within the community with strong relationships with the people in the community, the public health, the preventative care, and the basic diagnostics with reliable medications that can be followed up on, actually, you're beginning to address that problem from multiple different angles.
That's amazing. This is here. I mean, I got a blood draw for a cholesterol test at Kroger. Like literally, it's,
Yeah.
oh, sorry. This is starting to become much more mainstream everywhere because, face it, populations are increasing, medical constraints are happening, higher regulation never results in better throughput. So the more we regulate the medical profession in the United States, the less access people have to medical care, and that's happening across the board. You can get A1C test over the counter at Kroger and test your blood sugar to see if you're pre-diabetic right there for $20 here in the U.S. at Kroger. So having this access is important here in the U.S. because you could get waitlisted for a annual physical here in Dallas. Now, even more so in Kenya and all over in other developing areas or frontier areas. Like you said, you're 2 hours away from a medical clinic, but the trust level in that medical clinic is very low. Yeah. So you all are actually bringing this into more of a community-based approach,
Yes. And what the beauty of the model, of course, when you use a business, you use the economic engine, the sustainable engine to drive this so that we can grow to 400 locations. We get the economies of scale, we get standardization of quality, we get standardization of training, and it's sustainable, and it brings a return to the investor so that we can grow more, move into other countries. But it's doing public health, it's doing the public health service, so you get the combination of both. And this is the beauty, especially as donor money is decreasing, getting the public health system to work with the businesses, the vitality of that is just essential.
Yeah.
Yeah, and I would just want to say, add to that, business first type of approach, right? You're starting with sustainability in mind, but also I think one of our unique differentiators at ReFrontier Group is we are an operating holding company and foundation. And the foundation actually is a very strategic play with Katrina's background, and she serves as the CEO of the foundation. As she kind of mentioned earlier, specifically creating wraparound programs that, at least from there's a variety of paradigms you can look at it through, but one of them is economic, right? Which is it actually is serving to de-risk in a variety of different ways the investment and the business opportunity as it relates to Zana Life and the pharmacy supermarket chain and its growth, because they're creating different wraparound programs that serve the local population. And then from a branding standpoint, which we're all familiar with, right? There's sort of a stickiness type of effect where if you're doing something positive and useful and meaningful, you're anywhere in the world, you are engendering sort of a positive association with that brand, and people become aware and they go, oh, I think when I need to meet the pharmacist, or when I need to pick up some rice or some local goods, right? Like I'm gonna pop in Zana Life real quick. So there's a very, I just want to mention, there's a very strategic, symbiotic relationship between the two, which is part of what makes us unique.
Yeah, and I think for me, being 100% transparent, when I first reviewed your pitch deck, I was like, these guys are everywhere. We've got a community. They purchased an analytics company. They want to open a pharmacy and a grocery store. I don't get it. And I don't get it. And if I don't get it, then I'm moving on. And so Doug, the chairman at Lions Center, was like, hold on. There's something here. There's a story that we're missing. Let's get to the story. And so I would say, before you all get here in a month, make sure that you have the whole connection of how it all connects, because you're gathering medical records from several hospitals, and you're doing that to drive evidence-driven medicine, but also to drive the hub and spoke model to make sure you're ordering the medications that are being prescribed, that the right medications are being prescribed. If you have a large population of a specific diagnosis occurring in these areas, then you can get that information to the pharmacist faster. So there's a specific reason why a nonprofit or a socially driven organization that is running pharmacies want medical records from hospitals, and there's a specific reason why for all these things. Storytelling is, you remember Mark Twain used to say, today I'm writing a longer letter than normal because I don't have time to write a short one. The short letter from you all has to tell that story in a small amount of time. You're going to lose people, but once you really dive into it, there's a reason why you bought an analytics company. There's a reason why you're going after medical records, and why that's driving social impact, and why it's driving grocery stores. Like, at first, wait a second, they're buying medical records, they're pulling that into evidence-driven medicine, they're doing epidemiology, they're building grocery stores. They need a logistics company. What is going on? And the story is you've got a full view of what it actually takes to deliver this frontline care and a plan for how to do it. But that's not an easy story to tell.
I think this has been Daniel's,
I had a feeling this is where Daniel comes in.
Yeah, and I do think one of the things that we have really set out to do as ReFrontier and is central to our model is we begin by saying, actually, our heart is to have nation level, ultimately in some cases continent level impact. Then what are the key drivers of change? You know, if what we're really at the heart, we want to see human flourishing take root across a nation, then what are those key drivers of change? What are and another way of asking it is what are the key barriers to human flourishing? And we took a lot of time in Kenya to really look and understand what that was. And again and again and again, healthcare came up. But it's not a simple thing to solve for, right? And this is where I think the beauty of ReFrontier is having an operating holding company that can bring together these synergistic businesses that solve for different parts of the health problem, right? Different parts and elements of the health crisis. So you've got 30% counterfeit medications. Okay, well, we need to solve for that issue. What are we going to do? We do a minority investment in a pharmaceutical wholesale company. You have 2/3 of the country that lives over 2 hours away from quality healthcare, and the principal seekers of healthcare are females. Well, how do you bring healthcare closer through a pharmacy model? Why do we do a supermarket? Because women are also the chief purchasers of daily household essentials. So if you want to create stickiness where you're getting regular access to women and children who are the drivers of health outcomes in this country, then you combine those models together. It also just makes a whole lot of sense economically. That's it. And then the third piece that's it. And then we looked and we said, and on top of that, you have globally 1/4 of the disease burden comes from Africa, and yet only between 2 to 4% of that actually upstream is developing those pharmaceuticals, developing those diagnostics, developing those treatment protocols comes from this continent.
Only 2 to 4%.
2 to 4%.
So it's woefully underrepresented, and therefore bringing back bad results.
So we were looking and saying, well, even if we push out these solutions to local communities, actually upstream, who's developing the pharmaceuticals? Who's even working out what diagnostics and treatment protocols are going to work best for this continent? We need to get into the data business. But you're absolutely right, Isaac. What it means is that you're actually having to tackle an issue in the round. The beauty of it is you then get a series of companies that actually synergistically pull in the same direction.
Yeah, it's a harder story.
A lot of experience on the data side. So for me, I hear, all right, how many hospitals are you all collecting medical records from?
So we have, in just 4 months, we've gotten 232.
So 232. Average records per day, 1,000?
Well, so that'll represent about 3 million patient records.
3 million patient records, okay. And now through your analytics company, you've processed 200,000?
Yes.
Okay, so for me, that's like, okay, we have processed almost 1 day's worth of medical records. And so for me, I think, oh my gosh, it's handwritten. Sure that processing that, I know that you've got a way to do it, but do you have a way to do it every single day, 365 days a year, and then bring that back down to the evidence? Those are challenging problems you're tackling. You're not shying away from challenging problems. And then you get into, all right, now we got logistics. How do we get the non-counterfeit medicine here? And how do we then get it to the right hub and spoke? I did the network optimization project for a $2 billion a year company that supplies, well, let's just say if a group of firemen were going to come together and use a big gas box for delivering their sandwich, I know where those boxes come from and how they get close to where they're going. And that's huge challenges, making sure you've got the right thing at the right place at the right time. And those things don't have expiration dates on them. So you guys have another really interesting challenge that you're not shying away from. And then logistics of driving around Kenya with very valuable medications. And then the logistics of making sure the pharmacist is trained and knows how to prescribe and administer the medications, the right medications, that the evidence-driven outcomes are correct. You have really, really complicated and really detailed problems that you're not shying away from. And not just one, a whole networks of challenging things. And you guys are like, let's do it. And I'm like, I cannot wait to see how they know that this is going to be successful instead of failing at any 30 of these different areas. And at the same time, I did not know that Kurt is capable of accepting an email from the wrong Kurt, and then taking somebody who wants to open a network of coffee houses and talk him into doing a network of pharmacies in Kenya. You're obviously a born team builder, which is what you're going to have to do to make this work. I'm seeing all of the areas where all of these challenges could make things go terribly, but also could really be an opportunity for amazing impact and really could go really, really well. And we're talking to a guy that could fly into Afghanistan and build $1 billion telecommunications company. So obviously, you know how to do this. I want to know. Well, teach me.
The thing also, though, that you have to remember is that where you're starting from, in a sense, the competition, it's not rocket science to improve by 50%.
Yeah.
You know, you need rocket scientists to improve 50% in America because it's already been optimized, right? In a place like Kenya, there's so much place that there's low-hanging fruit of optimization that actually it's not as complex of a problem as it would appear to do the same kind of optimization in somewhere else. Now, some would say, well, you don't have the tools here, but the reality is that where you're starting from, you're optimizing, man, you can make some big gains by simple systems, simple training. And that really is partly what you have to do, especially in the beginning.
So Kaizen applies a lot here. Find the biggest problem, solve it. What's the next biggest problem? You're never going to run out of biggest problems because every company has one little problem that eventually becomes the biggest one. So I am assuming that this isn't the whole team.
No, it is not.
By any stretch.
We have...
I'm the sole guy in the United States. So
he's the only guy in the U.S.
The token American.
So we have...
Token American.
The token American. We have a mixed Kenyan and expat teams. Our equity partners, Ernest Jura, James Masharia, are equity partners in this endeavor, in ReFrontier Group itself. And then basically everybody else is Kenyan, and we have an amazing
group,
an amazing team, really. One of our founders, one of our Kenyan partners, he developed a 52 location chain of pharmacies back about 10 years ago and then exited. So he's already done a 52 location chain. So there's that kind of expertise and experience that we're tapping into. Because I'm not a pharmacist, right? I can build things, but I'm not a pharmacist. But Louis had already done it.
And he was a two-time president of the Pharmaceutical Society of Kenya. So to your point about finding qualified pharmacists, like it is interesting, right? There's 2 points that come up to me when we're talking about doing business in frontier markets. And one is, for every challenge that I think particularly we see, especially when we're looking through Western eyes, right? Actually, there's 5 opportunities there. And we need to be careful about how we understand or gauge the challenges, because as Kurt said, there's also far less competition to scale and to differentiate yourself within the market. So we oftentimes say the challenges are just different, right?
It's not harder.
It's just different hard.
It's different hard.
And then the Second thing is you really, and I'm not sure that this is a particularly frontier market thing, but the value of really finding excellent people who are values aligned, who have experience and talent and are committed to deploying that together as a part of a team is enormous. And so we spend a lot of time and effort both identifying talent and building leadership.
Yep.
And doing that in super, super deliberate ways. We invest heavily in our leadership, invest heavily in finding talent. And we've been honestly just incredibly blessed with a group of colleagues and
equals.
Partners.
They are our equals.
And excel us in many ways.
Excel in many ways. We're better at certain things. They're better, but
you remember David was driven out of Jerusalem by King Saul, and he went and he lived in the mountains with the drunkards and the debtors and the outcasts of society, the losers. And 3 chapters later, dude's riding with 300 mighty men of valor. The same people. He took the folks others overlooked and trained them to be champions. We have I have pictures of people that I know grew up in incredibly impoverished situations and then competing at global scale with development competitions, holding a belt, championships. That's how we've always operated. Is you're not going to find enough pharmacists to solve the problem. Not the ones that are aligned and trained. You're going to have to make some. But sounds like you've got the people that know how to do that. You're not going to find somebody that has the medical, the quality medical systems that you need. You're going to have to build it. And you all aren't afraid to do that. Daniel, you know that if you're, the more time you spend with Kurt, the less likely you are to ever retire, right? I think.
It's so boring.
What is retirement?
I have a feeling that some of the exits that Kurt's been involved in, he would never run out of sandy beaches if he didn't want to. Looking for purpose and living that purpose the rest of your life is an amazing call. Finding the folks that others would overlook and training them to be champions. That's what God's called a few people to do. And I know for a while in my life, whenever the government told me not to go somewhere, I would be on the next plane out. That's not where I'm at in my life today, thank God. But I think we're cut from the same cloth. I love that. Daniel, I'd love to hear a little bit from you. Where do you fit in all this?
Great question. And you guys have a great rest of your afternoon once again. No, so with my background, I think one of the things that we all collectively talked about early on, and as everybody knows, when you're doing a new entrepreneurial endeavor, you wear a lot of hats, right? And there's always that question of like strategically, what makes the most sense given the whole picture? And I think it made a lot of sense given that I was already based in the United States, even though I don't technically have a background in multi-million-dollar capital raises per se. It just made a lot of sense for me to continue to be based here and to be based here in St. Louis. And it's actually quite convenient in the sense that being based in St. Louis versus where I came from, Portland, Oregon, before moving out here for grad school, it's easy to get on a plane 1 hour to 3 hours in any direction to meet, to go to conferences, etc. So that's the primary role I'm serving right now. When I joined as an equity partner with ReFrontier Group, I think my biggest challenge early on was just going around and listening and understanding different elements within let's just call it the capital markets in general. And then in conjunction with Kurt, Katrina, and our Kenyan partners, really figuring out like, okay, ultimately I think we're going to go like, in this healthcare sort of platform direction with this vertical. And even though, as you said, it seemed like, oh, there's this, and this, hopefully there's a better understanding, by the end of this podcast to understand like it's actually quite strategic and quite intentional.
I'd love to see the mind map behind that. I'm sure you guys have it, but I would love to see that.
And I'll end with saying, in terms of those different entrepreneurial hats, there is probably something on the horizon eventually of, putting on more of a managing director type hat and being based in Nairobi to lead a variety of different things as it relates to business development. I think with App Analytics in particular, in my health tech background and then just business development more broadly, we're seeing a lot more interest and opportunity that is originating on the African continent and then also amongst the GCC countries. So it might make more sense for me to be based, over there and to fly 2, 3, 4, 5, 6 hours in a particular direction to meet with folks as we grow.
And this is not a one country play, like the entire continent of Africa. I met with folks from Nigeria that fly to Turkey and use a translator app because they get better medical care than they would get even through the UN mission in Nigeria. So I'm very certain that this is not a let's cover this one country play. This is certainly a continental play, and also it seems like a model that would cover most countries well.
Yeah. And we love the hard places. So when we develop a model here, and
it's shocking. I hadn't picked up on that yet.
If anybody checks out ReFrontier.group, our website, all of the photography on that website, for the most part, I love pointing this out to people. It's Nairobi, and the number of people I have had that are, based here in the United States that are like, oh wow, like that's beautiful. Look at that shot. Look at that part of, one of the downtown central areas, etc. They are often delightfully surprised and going, oh, that seems like a very beautiful place to visit. And it's like, yes, please come and visit.
Yeah. Awesome.
Yeah, Kurt's father used to say, pray for our supporters who are less fortunate than us. And I oftentimes find ourselves thinking it. I mean, this is the most incredible place to get to raise a family.
Yeah, we're blessed.
Amazing. All right, well, I cannot wait to hear your pitch, meet you all in person. Man, it's just over a month away. Really, really exciting. Let's say any of our viewers see this and they want to reach out to you all either before or at the event. How would they reach you?
I think the best way would be to go to our website. We have a contact page. You can fill out that form. We'll grab it there. Additionally, if you're listening and you want to send an email to Daniel@ReFrontier.group, that's another direct way for me as a starting point. Yeah.
Awesome. Well, we love the Voice of the Founder series. Love hearing people around the world that are doing amazing things, both for in business, but also for God and to build His kingdom. Love seeing what you guys are doing. This has been another episode of the Voice of the Founder here on the Catalyst Effect in conjunction with Lions Den DFW. Come on out to the event on the 29th and 30th of April. Can't wait to see y'all. And Rena, Daniel, thanks so much for taking the time to be on the podcast with us.
Thank you.